The news that President Trump had tested positive for COVID-19 broke early last Friday morning. So, Mike, what was your initial reaction to that news? And in the days since, as more in the White House have tested positive, what have you been thinking about? What are the lessons we can take away from this outbreak?
Well, first of all, let's take a step back. I'm not going to comment specifically on the actions of any one person in the administration. That's what people would expect to have happen, and then immediately we devolve into a partisan discussion. But let me take a step back and say, if you were on this podcast as early as July, you heard me say that I thought that the testing program put in place at the White House to protect the president and the other senior leadership was not a plan at all. And in fact, it reminded me of providing all the Secret Service agents with squirt guns and expecting them to protect the president against an assassin. Let me just say a couple of comments about testing and what was done at the White House. This is one of those examples where there was a mindset you could test your way into safety, i.e. test your way out of the pandemic. Simply not possible to do. Testing is always going to be after the fact. It's going to be a situation that even if it is highly reliable, it doesn't protect you from being exposed. All it does is tell you that you were. And now some people would say, but if I know that I'm infected, then I can take steps to reduce my risk of transmitting to others. And that's, a great idea. But let's just be honest here. First of all, the tests we're talking about, these point-of-care tests are often coming up with more than 30 to 50% false negatives, meaning you're missing people who are positive. And so if you're trying to bubble yourself, that's one thing. The second thing, though, is I would acknowledge to those who promote this new testing approach, a strategy for containment, as they call it, this will help. But with one caveat. As we just saw what happened at the White House, will people actually use this information to actually change their behavior so that they don't transmit? And we saw a number of examples of people who were contacts of cases, who actually didn't abide by what we would hope would have been risk reduction behavior. So I'm not suggesting that's widespread in the population, but when you have almost a third of the public that doesn't even believe this pandemic is real, you have a number of people who are experiencing pandemic fatigue who just think it's too much, I don't want to deal with it. And you have a number of people who are bubbled in today because of their high risk of serious disease if they get infected. That doesn't leave a lot of people left in the middle necessarily who are going to be impacted by this kind of testing. And so the last piece is that also with this point-of-care testing, we're going to show very shortly that there is actually a very important number of false positives. And wait until people are taking these rapid tests and come out false positives only to be confirmed by PCR that they weren't positive at all, and see how long that's going to last. And watch that spread around as a challenge. Why not to take them? Because the next thing you know, you got to get worked up. You got everybody upset and concerned. And it wasn't even a true positive. So I just want to come back to this issue. I would support any kind of testing that might help actually reduce the number of cases. And I think the White House experience really is that. It shows you the challenges of using testing in a regards to behavior change and what it means or what it does. So yes, it can have some impact, but it's not going to have this major containment strategy outcome. And I'm sorry that the White House situation ever occurred, but I think it's illustrative of the point that we're making. And again, false positives and false negative point-of-care tests are occurring much, much more frequently than people realize, and they will dramatically impact, even among that limited number of people who are willing to consider taking these on a routine basis, what they ultimately will do. Now, what I have a hard time with is that no one addressed that situation at the White House, even though it was raised with them on numerous occasions that this was a terribly inadequate plan. Keeping in mind that this is what I have been basically saying, as many of you know, it is emblematic of we don't have a national plan for responding to this pandemic. So why should we be surprised if we don't have a White House protection plan? And so what this episode really should tell us is we still have a desperate need for a national plan of how to respond and how we bring the 50 states together, recognizing their diverse differences, whether they be urban or rural, whether they be west, south, north, east, wherever. But we need a comprehensive plan. We don't have that. People will say we do, but I defy anyone to actually come forward and tell you what our plan is.